Hello, everyone. Dr. Christine Smith back for a wonderful interview for you today with Dr. Robert Whitfield, who is an expert in the realm of breast implant toxin illness. So I'm going to go ahead and invite him on because he is an amazing doc who does a wonderful variety of healthy, holistic plastic surgery with an approach that's more functional to really understand how your body needs to prepare and how it needs to follow up afterwards to have the best results for your body, and also the interesting amount of toxins that can be hidden in this experience. So I'm just inviting him on. We're kind of but in all of this, there are so many different things that you can do and so many approaches that you can take so that you can really take care of your body in a way that is just so much more sustainable for our health in the long run and for everything that you're trying to do with your body to benefit. So I'm excited to have him on today. Hello there, Dr. Whitfield. How are you?
I'm trying to get taller so I can fit on this.
No worries. So thank you so much. I was just telling everybody a little bit about you. I'm great, thank you. But I would love if you could just share a little bit about yourself and what got you into this kind of niche of helping people understand the toxicity that their bodies deal with and ways to still get the outcome that they want, but with an approach that is much kinder to the body.
Sure. Well, thank you for having me on. And for your audience, my background is in oncology. So I did reconstruction for breast cancer patients, head and neck cancer patients, and sarcoma patients. Did that for almost 20 years. And during that time in surgical training, we obviously, whether it's our burn patients, ICU patients, transplant patients, we all concentrate on surgical nutrition. And I trained at a time when we didn't have hospitalists or intensivists to help take care of our patients. So as part of our surgical training, we cared for those patients, and nutrition was always a paramount concern in getting them healed. So a curiosity related to genetics and then our ongoing pursuit of just getting better healing or more efficient recoveries has led to our programs and processes. As it relates to breast implant illness specifically, I had a cancer patient in 2016 ask me to take down a reconstruction to make her flat. And that's become a more common procedure now. And I did her workup, her consultation, evaluation of all of her labs and studies. And she didn't have anything specific that was concerning. She did have a lot of fatigue, which was a very common issue with cancer survivors. They've had bone marrow suppression. So that was a pretty common finding. So I did her surgery. I took all of her capsular material out and her implants, took it all out intact, sent it off for pathology to review to make sure she had no recurrent cancer and to make sure that she didn't have any underlying infection in the pocket where the implant was. So when it came back after about a week, the pathology showed no evidence of recurrent cancer, which obviously is paramount, but she did have an underlying E. coli infection. And when I say that for your audience, it wasn't a little bit of E. coli. It was enough to be graded out as an infection in a hospital-based lab. So that's a significant finding, one that I was very concerned about not identifying before surgery and then finding out after the fact. So I placed her on antibiotic therapy based on the sensitivities that were shown to us by the hospital where it was done. And then she magically, as you would expect, didn't have fatigue anymore. So she had fatigue from an underlying infection, not from bone marrow suppression. So I believe it was her. She put me on a Facebook board or group and listed me as somebody who would do explant surgery. And then I had patients start calling requesting that. But more importantly, I had worried like how many people had this as an underlying issue and they were, either unappreciated because it wasn't a sign or symptom that had any kind of root that you could figure out from the diagnostic studies or laboratory values.
Wow. And that's one of the reasons I was really excited to have you on here is because it's just the things that people don't think of. And I love your background because that gives you such a broad perspective on everything that really affects the body. And understanding things like cancer and how they are related to toxicity and infection and things like that. And I think a lot of people don't think about what happens to the body when you have a surgery like that or are dealing with some kind of toxic burden. So I know that you have like a pre-op and post-op program that you teach people. I'd love if you could share a little bit about that.
Right. Along those lines, everybody, understands when we discuss inflammation, so we discuss it as it relates to aging. Inflammation is responsible for, both how we look physically when we age, but also our organs age. And then what I try to explain to folks is the program we have before surgery is very strategic to accelerate your recovery and make it more efficient after surgery. So we look at your genetics because we each have a set of genetics that we inherited from our parents. And I always like to say you can't outrun a bad diet and you can't pick your parents. So functionally, just like, we can only detox so much. We have ability based on our genetics, and then through exposures, and I talk a lot about our air quality, our fluid intake, and our food quality. And those can lend themselves to all sorts of things. So for your audience, when I talk about food, I recommend our patients only eat things that are pasture raised or grass fed, no hormones involved, so that we can avoid things in the meats they eat or the fish they eat or the fruits, things like glyphosates and phthalates in plastic water bottles all affect a woman's endocrine system. And then, of course, I'm concerned about heavy metals. Those can come from actually devices that are implanted like breast implants, or heavy metals can be found in groundwater, like arsenic's very common to be found in groundwater contamination. And then, kind of finally, one thing that's become near and dear to us in Texas is mold. We have a lot of problems with mold. And mycotoxins are really underappreciated. That's the toxin from mold. So I look at those critically because when you wrap all that up with how you detox and then your exposures coupled to your gut microbiome health, so we do a stool test for that and look at that, as well as food sensitivities and hormone balance, then you can paint a really accurate picture of how someone is behaving at that moment in time. And I describe breast implant illness as a chronic inflammatory process of which the breast implant is part of. But you could sub out breast implant for hip implant, knee implant, cardiac implant, whatever. It's still an implant. Your body recognizes it as foreign and it wants it out. So that's why it builds a wall of scar tissue around it. And when the chronic inflammatory process is going, that means all the signals for inflammation are on all of the time. And so you can't really turn them off. I recommend to all of our patients to start our pre-op program and begin nutrient supplementation because we have so many patients with gut health, more to help reduce their inflammation as much as we can prior to surgery, because I'm going to cause a big spike in inflammation and cortisol. And if you're already obviously suffering from a lot of chronic inflammation, I spike your cortisol. If you're already estrogen toxic, that's going to be a problem. And so afterwards, we work hard through having your detox plan, through the use of cell core products for that, and then ongoing nutrient supplementation and high protein diet, avoid dairy and gluten, and obviously no seed oils.
That was such an amazing explanation. I just kind of want to review a few points for people to bring back what he's talking about. So one of the things I also thought of as you're speaking is when you go through any kind of surgical procedure, like getting the implants in the first place, it is technically an injury to your body. And so then our body goes into an inflammatory response, like twisting your ankle or getting in a car accident or breaking your leg. And that causes leaky gut. It causes permeability in the gut because your body goes into a more permeable state so that inflammation can operate properly and white blood cells can go to the correct locations and do their jobs. But that also means that you're now dealing with a higher likelihood of starting to have food sensitivities and allergies and things like that. And even what we call subclinical levels of endotoxemia, meaning bacteria and debris in the gut are leaking back into the bloodstream. So that initial surgery has already kind of set off this cascade. And then now you're dealing with the toxicity of a foreign object in your body, which then further increases the inflammatory response. And then all of this can build up over time. And then, a couple years later, you might be struggling with a lot of allergies or kind of some autoimmune symptoms or fatigue, and kind of wonder where it's coming from. And it can be the combination of all of these things. It's rarely like one thing that's the issue, but if you had that procedure, and then let's say you had a huge emotional stressor in your life, like you were grieving, or something happened to your home or your job, like that can then trigger an inflammatory cascade as well. So there's so many different pieces of this, in addition to all the environmental factors that he mentioned that are already compounding in our lives because they're hard to control. So I love that you actually take like a functional minded approach to all of this. And I guess like for people wanting to have better surgical outcomes, or even like people who do want to have implants, I'm guessing overall you recommend against them, but I know you also still do some cosmetic procedures like I'm sorry, you called it, I believe, the no-cut facelift.
Yeah.
So what are your opinions around those things of just how to have the best outcome? What's the most important in healing? And what do people do when they do want to have these things, but they want to do it intelligently? Oh, and then there's some questions that in the chat that I want to follow up with after.
Well, my book will be coming out about the recovery program, so everybody can take what they want from that. And really, the educational part that we want to provide is that you can recover more efficiently. There are ways to do it in each type of surgical procedure, whether it's a knee surgery, an OB-GYN surgery, a cardiac surgery, whatever it may be. We have a program and process in place that will help you recover quicker by lowering your inflammation pre-op and then having the right supplementation throughout the process. I think you did highlight something very specific, that I have people who suffer a lot of psychological trauma, and then that ends up affecting them significantly, either through a loved one, sometimes a childbirth that's stressful. I mean, all sorts of things contribute to the problem. So I'm glad you brought that up. I think mindset is an underappreciated part of the programming I'm trying to deal with. So we actually partnered with a psychologist to help our patients. And we have health coaches too. I think as we look down the path, what I would like is I would like a paradigm shift in surgery, so that we take a very specific approach and not kind of not give the due to the functional part, but include it more and more and more along with genetics. I think that would help everybody, because I think the best situation is a blended approach.
Absolutely. I really agree with that. And the blended approach, like, it's not to say that, people can't still do aesthetic things. I think that is a huge part of your practice. So I want people to know, I just want them to be educated so that they know to ask the right questions or look for the right people like yourself. So there's some good questions that came in while we were talking. And I know I had watched something on your channel earlier where you were talking to someone who had implants and was doing sauna too much, and then their implant started leaking. I'd love your thoughts around that. But someone said, speaking of toxicity, I think one of my implants has leaked. How long do I have, or is there a time limit for when I should remove it? And then there's another one I can ask after.
Yeah, and I didn't hit on the last thing you asked me. So how do I guide people who come and ask about implants? Because I don't tell anybody what to do. I think from my standpoint, I try to educate people so that they can make an informed decision. I don't place implants and haven't for several years now, because my practice is focused on helping the women who need help on explant.
Yeah.
So you and I can't change people's opinions. We can only provide information so they can make an informed decision. As it relates to a device, so if a device is malfunctioning because the shell integrity has failed, meaning it's saline and it leaked and deflated, or it's silicone, it's leaking, and that's been evaluated both either on exam, ultrasound, MRI, mammogram, then I recommend a device that's leaking comes out. Sooner rather than later, always. I just took a set out yesterday that was ruptured, leaking for a long period of time, and I don't recommend that. That's not the best for the patient.
Yeah, I agree. And I know, I think you've done almost 1,500 explant surgeries, so you've seen a ton of this. I'm curious, what would be some of the things that you have seen that you would just want people to know and to be aware of?
Yeah, we're over 2,000 now. We actually did the math the other day.
Oh, wow.
So for patients, I think there's a lot of specifics that I could give you in terms of symptomology. In terms of breast implant illness symptoms, they can affect every system of the body. So I always tune into things like light sensitivity and sound sensitivity and headache for neurologic inflammation of the central nervous system. And the peripheral nervous system, they can have all sorts of extremity issues, pain, that's neuropathic, so tingling, burning, even vibratory symptoms. They can have dry eyes, difficulty swallowing, um, uh, shortness of breath, chest tightness, chest pressure, palpitations, that kind of heart racing feeling, and then muscle pain, joint pain, and then everything in the GI tract that you can possibly think of that can be wrong is a function of a patient, whether it's constipation or diarrhea or reflux type symptoms or pain with eating or swelling or bloating, I mean cramping, like whatever you can come up with as a symptom, I've heard. And then intractable UTIs and bacterial vaginosis and candidiasis overgrowth and whatever you can come up with, I've heard at one point or another.
Yeah, because it's all really tied to the chronic inflammation, not
Yeah.
just like the location of the chest and the body. And I had someone else who asked, my recent mammogram showed benign calcification and I had implants 10 years ago. I also have capsular contractions. Would the calcification go away with an explanation? I have my own thoughts, but I'd be curious as to yours.
Oh, with an explant. Yeah, typically, yeah, the calcification is typically around the surface of the scar. So that's a common thing. Your body will deposit and make calcification on its response many times, so that's not uncommon.
Okay. And the other thing people can think about is like when your body is in this mode of doing that, like laying down scar tissue and laying down calcifications to protect you, it means that it's in that mode, and it might be also depositing those things elsewhere. So if you have increased inflammation and you have those bits going around the body, it could be, affecting your joints or affecting your circulation or affecting other parts of the body as well. So just things to consider. With all of this, I mean, I'm basically like, it sounds like if people were considering implants, you'd advise against it, which I tend to be a little bit in the same category, but I also want people to have their own opinion and do what they want. Someone had asked, are fat implants better than synthetic implants? But again, I'm going to remind people that, every surgery your body goes through is a lot on your body, but I'd be curious as to your thoughts.
Yeah, so I've done several thousand fat transfers. I did them initially for cancer patients starting in the early 2000s and conducted those, 150 to 250 per year for those patients to help their results get better and have more aesthetic appearances after breast reconstruction. And so we've provided that service for our explant patients, which has been very valuable. I think in the group who would get an augmentation and want their own fat use, which I have young people come to me now and ask me about that. So one, you need the volume, and typically when we're younger, we're leaner, so it's harder to have enough fat for the plastic surgeon to go ahead and do that augmentation with. But yes, that is a very viable route, and that would be a fat transfer to the breast, just like they do fat transfers to the buttocks. And in terms of implants, so basically if someone wants several cup size changed, it's typically going to be an implant. And it's better to be informed about the pros and cons of them as it relates to both having a device. Say, for instance, when I trained, I'm old now, there was mechanical heart valves. And so you could put your head to someone's chest and hear the heart valve ping. And we all knew that that patient, when they went to get a colonoscopy or when they went to get a teeth cleaning, they needed to take an oral antibiotic as prophylaxis to protect them against seeding their bloodstream with bacteria, because that was going to happen in those procedures. So I think the same thing was always true for us when we took care of our cancer patients. who had breast implants. We had a standing order at our office if someone's going to get a teeth cleaning, colonoscopy, other invasive procedure where you could get bacteria in your bloodstream. That was just standard of care. I think that should always be the standard of care with somebody with an implant, and it is for orthopedic patients and other implant patients. But I don't always hear that out of the patients who come to me asking for an explant. So we can always do better to protect the patients. And I know patients don't want antibiotics, but there's a very specific reason that I bring that up. So biofilm, which is present in my series of over 1,100 patients consecutively followed at about 30 to 34% when you look, that is from usually, in my opinion, bacteria getting in the bloodstream. And that can be from a cold, a urinary tract infection, a skin infection, a GI infection, whatever you want to highlight as an option. That's typically how that happens. We want to do our best to always protect patients from that.
Yeah, absolutely. So in all of this, I know you also do other procedures like the no-cut facelift.
Sure.
What do you spend a lot of your time doing now in addition to the explants and the education for clients of really how to optimize their bodies around any procedure they need to have?
Yeah, I wrote our book about this, and I feel like I spend all of my time trying to educate people either on the process or educate other physicians. I want other practitioners, and I appreciate obviously how much you know about this topic. I think we're a little shy of where we need to be as we think about it as a group. So if we just take all the practitioners of all different credentialing and say, all right, you have a patient with breast implant illness, or we'll just say we have somebody with chronic inflammatory symptoms who has breast implants. First, have we asked if they have an implant? Two, what is the information regarding the implant, its surface, meaning textured or smooth? Is it intact? Has it even been surveilled? Has someone done an exam? And then, are all these symptoms consistent with a chronic inflammatory state? And if so, what has the workup been? And if it's all really been negative, why are we not paying attention to the fact that there's an implant in place? And that could be the big driver in the engine of chronic inflammation.
Yeah, definitely. And in addition to looking for those things to prepare people properly, I mean, so tell us a little bit, because I was just curious when you said the no-cut facelift, how is that working for people so that they can, do procedures that they want, but it's in a way that is much gentler to the body?
Yeah. So the no cut I came up with as a combination of things over the last 7 years where I've looked at different energy-based therapies or minimally invasive options. So the no cut is really born out of trying to bridge the gap between a facelift, which is standard and requires surgical excision, visible scarring, fair amount of downtime, but really you're always going to have a visible scar. There's no way to hide that. So I don't like visible scarring, and I don't do tummy tucks anymore because I can't stand the way the scar looks. And I don't like the scar around the ear. So basically, radiofrequency energy can tighten skin. So I use FaceTite to tighten the cheeks and the neck skin. And then we do a minimally invasive neck lift if, in fact, someone's neck's aged to the point where it's obscuring their profile. So we do all those under local. And then the final step, which is really what, spawned the whole no-cut movement, is it's a product called Elicor, and we take skin out without leaving a scar. So for the audience, they've probably all heard of microneedling. You may have had it at a spa. Sometimes that just feels like a little poke. Then there's microneedling with energy. There's different types of that technology, and I have Morpheus 8 at my office. So that's a type of microneedling that goes 1 to 4 millimeters in depth, but those are all solid needles, and they just make little poke holes like you're aerating the lawn. Your body then, from that injury, heals, builds more collagen. That will create a tightening effect, although it's not a big visual tightening effect. Now, fast forward to something that's a hollow needle, 0.5 millimeters. It goes in and takes out a little piece of tissue. So if you do 26,000 treatments around the face like that, you'll take about an inch, inch and a half of skin off the face. So if you think of someone as young as you and we started doing that now, you really wouldn't get to an advanced stage of aging where you saw more line and wrinkle and fold formation, because you would have kept up with the skin laxity as it developed over time. So I feel like, I'm 55. I can't go back and change it, but I would get I've tried to think how I could do it myself. But so those are the things that I look at as we get closer and closer from like a technology perspective to a facelift.
That's really cool. So basically, you're just tapping into the body's own innate intelligence for maintenance by doing essentially a little micro injury, much like regenerative medicine does.
Right.
Very cool. I love that.
And then over the top, since we have a stem cell device, I can take your fat out and over about an hour and 45 minutes, give it back to you either IV or as an aerosol on the top when we're finished. So we can do that as well as exosomes. So we try to do everything either with your own genetic material, if at all possible, or we have best exosomes available. We have really great skincare products. We have my hyperbaric, which people go into right after they finish that.
Awesome. So it's like such a holistic approach. You have hyperbaric in the office, you're getting people on the right nutrition, you're having them remove toxins from their lives, you're physically removing toxins from their body when they need it. We go back to the word inflammaging. If inflammation causes aging, just taking out the inflammation, you can actually have a lot of anti-aging effects. So this is really cool stuff. I love what you're doing because you're still helping people get the results that they want, but you're doing it in a way that's much more kind and in alignment with like how the body operates. So in all of these, like, because I know you were talking on another podcast at one point about things like, these are plastics and different things in our body, and it affects our cortisol response, which then affects things like our sex hormones. And I think you even said you had one patient who had had a really hard time getting pregnant, and you took out her implants, and in like one cycle, she got pregnant. Like, I'd love if you could tell us just some of the stories that you found amazing like that.
Yeah, I think, obviously women have a much lower level of testosterone, about 1/12, basically. And you have a lot more stress in terms of hormones with cortisol and estrogen. So I think that as the inflammatory background grows in my clients, in females, it seems like your thyroid's affected initially. That seems to go off right away, and people have all sorts of problems with that. And there's great friends of ours who take care of that, like Amy, the thyroid fixer. But just in general, that's a huge problem. And Isabella Wentz has written a ton about the right diet for that. But so, like, why is that happening? Right. So
I call it the sentinel of the body. It is that organ that senses that something's off.
and it's almost universal in my patients. That's the first thing. So how do we deal with that? Well, everybody, for the most part, is coming in on either synthetic, or they tried synthetic thyroid and it failed, and now they're on Armor or something else. And so, okay, so they're already off. You get their genetics back, and they typically have this bent towards estrogen toxicity. So they'll typically have, which is not checked for some reason very often, a very high estrone level, which is a very bad actor that you can help offset with DIM and Kristen. So you can take holistic supplementation to help with that. So we do that for our patients. And then, we look at their sex hormones, and a lot of times they're just completely, almost immeasurable. Like, I've had people with almost no free testosterone. So in a woman, it's like 0.2 to 2.6. And so, and they're like, I have a lot of fatigue, I have no libido, I can't concentrate. Well, these are all symptoms of both chronic inflammation plus suppression of that hormone. So we'll talk about how to address that during the time around surgery. I don't manage hormones chronically for people. I do around the time of surgery because I want a specific background of the testosterone, if in fact everybody's on board with what we're doing. But that's what I see. And as it relates to fertility, I think the more inflammation you create, the more difficult it is for a woman to have, whether it's her cycle or just the right background for fertility.
Excellent. I think those are huge points because people, especially women, are dealing with so many hormone issues these days. And, that's emphasized by the environmental toxins we mentioned at the beginning. So it kind of comes full circle. But yeah, just great knowledge for people to have. And I know you're always learning, like we know each other because we keep showing up at the same great places with really great minds that love to learn. So it's wonderful. What is one of the most interesting things you've learned recently that you'd really want people to know?
Recently, something that I've learned. I think there's a little bit of lots of concerns about like hyperbaric and cancer. So I think and I see a lot of a bent towards holistic care in oncology now, which is great. Lowering inflammation and combining what is a more functional with a allopathic oncology background. That's tremendous for patients. And I really like the bent towards them using hyperbaric because I think that's very valuable. So that's something that for me used to be like dogma that was bad, and that has changed. And that made me feel good. I think, the more things we can do to help people with lymphatic drainage and better oxygen and better food, especially better nutrition from a nutrient standpoint, the better they'll do.
Absolutely. And for anyone who's not familiar with hyperbaric chamber, it's basically a pressurized oxygen chamber that induces epigenetic gene therapy, said simply. And by sitting in there with a concentrated amount of oxygen and the pressure, they both have different effects that can turn genes on and off. And it can really affect inflammation. It can affect tissue healing. It can be really helpful for cognitive decline. It can be helpful for recovery. So always worth looking into. And, when we talk about this stuff, it's for education. So just a reminder that none of this is medical advice. Please ask your practitioner what is right for you. But just giving you things to research and things to ask about so you know that they exist. Thank you so much for taking the time to do this. Like, I love getting to chat with you. If people wanted to learn more about you, or they wanted to work with you, or there's anything else you wanted them to know, like the name of your book, where would you direct them?
So I think if you're interested in breast implant illness, we've put together a series of shows on my podcast, Breast Implant Illness with Dr. Robert Whitfield. They're quick hits. They help explain it. I've also done a lot of guest appearances, both on Dave Asprey and the Skinny Confidential. So there are a lot of shows you can look up and learn about that. Our book is coming out to really enhance the healing process. It'll be out hopefully in Q2, and when it is, I'll pop back on here and have everything out for that. And then if you want to contact us, you can go to breastimplantillnessexpert.com or follow us on IG at breastimplantillnessexpert.
Awesome. Thank you so much. I have a number of people that I know will benefit from this information that I am looking forward to sharing with them. Thank you everyone for joining. If you guys have any questions or you want to know more, this will be posted on the feed. Please comment below and we'll go ahead and answer your questions, and we can always address that in a follow-up. So thanks for taking the time to do this, Dr. Whitfield, and I hope you have a wonderful rest of your day. Yeah, it's good to see you.
All right. Bye-bye.